Thank you for joining me for today's COVID-19 daily update. I'm pleased to be joined, of course, with Dr. Jose Romero of the Department of Health, Dr. Greg Bledsoe, our Surgeon General, Secretary Johnny Key of the Department of Education will have some remarks as well, and I appreciate them joining me today. And first, let me say we've been blessed first with Dr. Nate Smith, with such a national reputation as our Secretary of Health. And of course, he's gone to the CDC. But we also have been blessed with Dr. Jose Romero, who also has a distinguished national reputation as well for his work with infectious disease. Dr. Romero moved to Arkansas as Director of Pediatric Infectious Disease at UAMS, I believe it was in 2008. UAMS, I believe it was in permanent cabinet level Secretary of Health, and we're very, very pleased and honored that you are willing to accept that responsibility. And I failed to add that part of his national reputation is that he serves not just on the Advisory Committee on Immunization Practices, but he's actually chair of it. So he's chair of a very important national committee that will help guide the immunization program for the COVID-19 immunization that we all hope for. And then let me move to our cases today. First, yesterday we had 45,381 cases. We have an additional 912 cases today. Of these, 158 are in the correctional units. And as you will be able to see in a graph shortly, that means we're fairly flat for community cases. Hospitalizations have declined by 10. We're now at 516 hospitalizations. We've had an additional 18 deaths. That brings it to 508, over the 500 mark, regretfully so. Our total cases of 46,293 cumulative, and of the new 912 cases, of those, here's the top counties. Chico County with 149. Of course, that is where the Delta unit is, so that's the reason that small county has such a high number. Pulaski County with 79, Sebastian County with 51, Washington County with 42, Mississippi County with 35, Garland County with 29, Craighead County with 28, Saline County with 26, Pope County with 24, Ashley and Crittenden County with 21 each, and Benton County has 20. So that's almost, it'll be interesting when Washington County and Benton County drop out of those top counties that are over 20. Of course, that's sort of a hopeful wish that we will get there in those high population counties. And of course, Pulaski County we hope moves down as well. Let's go to the slides to take a look at our new cases, and here you'll be able to see that the orange are the community cases, the white is the correctional cases. We don't mention it very much because it's sporadic that we have a large number of cases in our correctional institutions, but over the last 24 hours we did, and so that's the reason for that spike. Other than that, it's flat in terms of our community cases. 7-day rolling average, you can see that as well. For the trend line, the number of active cases, we're not at the peak in terms of active cases. I hope that stays that way. Right now it's about 7,000. And this is the hospitalized patients, and that goes up and down day by day, just depending upon the condition of the patients. That's down for today. And this is the 7-day rolling average of percent positive tests in Arkansas. And as someone pointed out rightfully, there's always seems to be a dip toward the end. Well, that dip toward the end is a little bit misleading because in subsequent days, we're going to have new information on those tests comes in that backfills that and will actually flatten out that dip on the end. So that remains to be seen, but I wanted to be able to explain why that is the case. Go back to the other one again for a second. And of course, we are right at the 10% positive. Yeah, that's a 7-day rolling average. You can see we're actually too high on that. I hope that does come down. And then the test results, and here again you can see the challenge we face. Department of Health did moderately well in the white, but the red, we had a slower day in terms of the public labs, the commercial labs, and that's one of the reasons that our testing over the last 24 hours is 5,077. Over the last 24 hours is 5,077. To make sure it doesn't happen. And that depends upon our behavior. It depends upon our wearing masks and our social distancing, continuing to take this seriously. And the UAMS model in terms of cases projects 55,000 total cases by August 10th, which is not that far away. And that's where the white line would be if we followed that model. The model that we want to follow has to be less than that, and we'll be able to measure ourselves over the next few days from that. The UAMS model also projected by August 15th 3,686 cumulative hospitalizations and 543 deaths, and so that's is something we're going to have to watch. And of course the modeling in that close term is what they're providing us now. I think in a couple weeks they might provide us with some longer term projections, and I look at those projections and I say, let's see what we can do to beat those projections and make sure that doesn't become the reality on the ground. For all of those that are interested in band and choir, that's important to so many of our students, and the Department of Health has put up on their website the new directives and guidelines for school-sponsored music, band, and choir. Obviously, this is a risk area, and so the guidelines provide a number of different protective measures in order to protect the students and those that are around and the staff as well. But this gives them an opportunity to mitigate, to work through this, but share the music that they enjoy and love. Secondly, I want to talk about prisons for a second, and I'm pleased to announce today that we have set about the plan to test 100% of the inmates in state custody through our state prison facilities. And currently we have 19 state prison facilities. At this point, 10 have already been fully tested. All the inmates in 10 of the facilities have been tested, including the Delta unit, and that's one of the reasons that we discovered additional positive cases there through, we call it mass testing, but it is 100% testing of the inmates in those facilities. So we have 9 more to do. Our goal is to have 100% of our inmates tested by the end of this month. And as part of that, I've authorized 10 National Guard personnel to be able to assist in the, as medical clinicians, to assist in the taking of the samples from the inmates to make sure we can meet this goal. That was a request by Secretary Graves that we provide that assistance, and we thank the National Guard for making those resources available so that we can take that action in our state prisons. With that, let me invite Dr. Romero for his comments, and then we're going to have Secretary Key will make an additional announcement today.
Thank you, Governor. So before I begin with the numbers, let me thank the Governor for this appointment. I realize it's a significant honor, and I greatly thank him for the privilege of serving the public here in Arkansas. It will be a tough act to follow, will be for Dr. Nate Smith, and we have a very illustrious number of secretaries of health that have served in this position in the past. So I will strive to meet that expectation. So let me go forward then with the numbers, additionals. Hospitalized patients, we have 10 less than yesterday at 500. 77 specimens yesterday. 1,509 came from your Arkansas Department of Health Public Laboratory. Commercial private laboratories, 3,105, and UAMS, 406. And that rounds off the numbers for today. Thank you.
So today we're announcing a new call center resource. This is Ready for School Resource Call Center. This was actually established this week. It opened on Monday. And the purpose of this call center is to provide a readily accessible, phone accessible resource for parents, teachers to be able to call if they have questions. We will take this opportunity to either get the resources they need or direct them to the right place. This is something very important as we get closer to the start of school, that parents are going to have more questions. Obviously, many of those questions will be dependent upon the work that's happening in their local school districts, but we will work to make sure that we get those answers for them. It's also important that we provide this resource to all Arkansans, and that's why I'm very proud of the partnerships that we have here. We are partnering in this endeavor with UAMS, with the Arkansas Department of Health, with Arkansas Children's Hospital, the Republic of the Marshall Islands Consulate, the Arkansas Bilingual Bicultural Education Support Network, and the Office of Coordinated Support and Service. This call center will be open currently from 8 to 4, Monday through Friday. The number is 833-353-6050, 833-353-6050. And obviously, we will gauge the level of response we get, and if we need to look at expanding the hours of that call center operation, we will be doing so as well. But really want to express my appreciation to the partners in this endeavor as we seek to continue to get information out to our parents.
Thank you, Johnny. And I ask Dr. Greg Bledsoe, our Surgeon General, to chair the advisory group on high school sports. They have met. He just came for a meeting from there. Just wanted him to give a brief report.
Thanks, Governor. The committee to look at reopening high school sports has met twice now, once on Monday morning and then once this morning. I just came from that meeting. And I've been very pleased. It's been a very robust discussion. If you look at the number of people who are on that committee, it's a very diverse crowd. It's a group of individuals who are very committed to their communities. They're committed to the student athletes and their leaders in their respective fields. So we've had a lot of perspectives shared and a lot of great discussion. I mean, obviously, we are still in the middle of a pandemic, and our focus is going to be on mitigating the risk of the spread of COVID-19 and making sure that we can for them later, rubbing shoulders with mentors such as coaches, and other activity leaders who can have a tremendous impact on their lives. So we recognize these opportunities, and we're committed as a committee to discussing all the different issues so that we can find a safe and effective way of moving forward with some of these extracurricular activities in the near future. So thank you very much.
With that, we'll take any questions.
You have this new resource line, but I'm wondering if you have any new answers for some of the concerns teachers have regarding their health returning to school, or questions of if they need to quarantine, how compensation will be worked out?
In reference to your last question on how compensation is worked out, again, that's handled by the district, but I've asked Secretary Key to return on Friday, and we hope that we'll be able to we're working on additional plans and hopefully have an announcement that might be prepared that would be helpful for our teachers to give them some confidence in the event they have to be isolated. So we're still looking at that, working on that, have some more information down the road. And that's just an example of the process that we're going through. We're listening to teachers. We understand the concerns they have. Secretary Key is working with the local districts in terms of making sure that they have PPE. If there's better quality or new innovation that we can implement or that we can learn, we certainly want to learn. We certainly want
schools yet. I think we've seen some positive cases pop up after school has started in about 3 different states. So are there any initial takeaways?
First of all, I think the takeaway is there's not any real surprises that you've had positive cases. You've had some teacher staff in different states have had to be quarantined, or students, and they've addressed these issues and they try to move on. It's still early. We've only had, I know Georgia, for example, had, I think it was 300 teachers that had to quarantine, but it's closer, we will see the experience of more and additional schools and their success rate and the challenges that they face. You know, I've learned from my fellow governors some ideas on PPE as to how we might be able to do it better that we're looking at to see if it's workable here in Arkansas. Secretary Key, and feel free if you want to jump in on any of that if you've got to add. Some of these questions are related. Did you have something?
Thank you, Governor. I think one of the takeaways that I have seen in just the first few days is the resilience of children. You know, one of the things we worry about is will they keep their masks on? And many of the reports that I've seen from states that have had earlier openings like Texas, that seems to be going very well considering what we were concerned about. So we're looking at those information that's coming from these other states, again, looking at practices that might help us do a better job when we get started.
Yes.
After seeing the UAMS predictive model, are you considering any other increased efforts by the state to try to minimize the spread?
No, I didn't see anything startling in the predictive model of UAMS. It was short term. I mean, we can look at the future, and it all depends upon how many cases we have every day. So there wasn't any additional concerns that I had from that predictive model. There's some more things we want to look at, but I think whenever they provide additional modeling in terms of long term, we might learn more at that time from what they're saying.
In terms of the football practice that started this week, have you seen any from the sports advisory committee? Is there going to be some type of written guidelines that are issued, or what's kind of the status of that?
No, the sports advisory group is a advisory group to me as governor to give me their counsel as well as to the Department of Health. And so I've asked for some their guidance and suggestions to me and to Dr. Romero this week so that we can make further decisions in regards to the contact sports as we look into. I've sent the signal obviously last week that we want to be able to have those engaged and participating, but we needed to have a broader look at it in terms of what are the best practices. Do we need to make any adjustments in order to have the best opportunity not only to start a season but to hopefully finish the season? So we expect part information this week, and I've asked them to work for probably 90 days. Continued guidance as you go through the season and unexpected items come up. In terms of our experience this week, I'm not aware of any issues that have developed. Of course, this is Wednesday, and they have moved to helmets, and then I think today maybe shoulder pads as well, helmets and shoulder pads. And so, I didn't expect anything dramatic from that exchange because they've been practicing together as a team. They've just added a little bit more padding and helmet to it. So this is a start this week. Obviously, if we continue, which I expect that we will, next week will be more contact drills, and that is a little bit more challenging, but you're still working with the same team.
About allowing football to get into contact, that it presents sort of, we're kind of more back to normal to the general public.
Absolutely. It's the same way of lifting some of the restrictions on restaurants and gyms that just because those restrictions are lifted, it doesn't mean we're back to normal. And we try to emphasize that. Wherever we are in this pandemic, we need everybody to wear their masks.
Just writing down the note the governor just said, just because restrictions are lifted.
Else. If they're not engaged in sports or banned, they're going to be doing something else that could be just as risky behavior in terms of the virus. And so we're trying to put them in a better environment that can have proper guidelines and adult supervision, gives them that structure. Still risky, but you've got to mitigate that risk. Are there any questions from our remote locations?
Yeah, Governor, this is Andrew with AP Springs.
I think you're on mute. I can't hear you anyway.
I'm sorry, sir. I saw an article from the National Governors Association that some of the governors back east have formed, I guess, a compact or a co-op for cooperative purchasing of things like testing gear.
Looking at where we are now with our case numbers and our positivity rate, do you think that we can make a significant change by that, if that's possible?
The answer is yes. And the answer is from the experience that our medical professionals have observed nationally and other states, that if we all mitigate, if we all wear our mask, if we socially distance, then that's exactly what brings the case numbers down and brings the positivity rate down, because the virus can die, can reduce its impact. Now, that is all dependent upon individual behavior. And if you can have all the guidelines you want and you can have all the mandates you can put your pen to, but if people are not taking responsibility, then you'll see you won't see much difference in the next couple of weeks. And so I think everybody wants to pull together. That's what we're trying to do, is to pull together to make sure we can be successful.
In terms of the UAMS modeling, is there anything that they've got that sort of projects active cases? Because I know when you see cumulative, it's kind of an ominous looking number, but I think as we all come to learn that just because we're at 40-odd thousand doesn't mean we're at 40-odd thousand active cases.
Oh, absolutely. I didn't see that reference of active cases in their modeling, but that's a key ingredient. The cumulative cases just really tells you what new cases that you're having, which is informative. But we want to take a little deeper dive into that. We might have some more comments on that modeling as we continue to have the opportunity to compare it with real data and see what we can learn from that. Now, are we online? Is there any other?
Governor, this is Andrew with AP. Can you hear me?
I can hear you, Andrew.
I want to ask you and Secretary Key about the instructions that went out to districts today regarding on-site instruction and the requirement that schools have to be open to students. My understanding is five days a week. And one instruction, what does that mean for districts that were planning an alternate schedule or blended schedule? And I guess why send out this instruction this close to the start of school? The Education Association, State Education Association, asking for suspension of standardized testing.
I'll let you take the first whack at that.
Thanks, Andrew. And the answer for on-site instruction, we have said since and have school on-site. So we had been made aware that some districts were making plans that were fewer than 5 days, and we felt like that the clarification was needed today to make sure that districts understood we do have a state responsibility. We have given flexibility for districts to offer virtual options, blended options, and on-site options, and parents need that, students need that. So we just clarified the stance that we believe has been our stance all along and certainly reflects the stance of the governor. Regarding the AEA request, we did receive that request, but the testing requirement is a federal requirement. That was waived by the federal government, by the U.S. Department of Education in the spring. At this point, they have not issued any waivers for that, and as a matter of fact, right now they are not considering waivers for the mandated testing. So in Arkansas, we intend to proceed and follow the law. If we don't, then it puts federal dollars at risk, and that's not good for our students.
Just a second. Let me just add on the testing that as governor, as someone interested in the education of the state, the testing is very, very important. And you say, well, they might not do that well because you were out last year. We've got a blended environment this year. And the answer is we need to know. We need to know the consequence of COVID-19 on our educational system and the progress that students are making. And so to me, it's an important measuring stick. Obviously, you got to look at it from a health standpoint as well, but Secretary Key answered that well, but I wanted to add that I do think it's important. Next question.
Dr. Romero, page 42 at 4029. In a Q&A with school superintendents, you said that it would be the health department's call to close a school if a district experiences a spike in cases or there's an outbreak. Has the health department created metrics for determining a closure, and how would you work with school superintendents to make these decisions?
Drat, I wanted to hear the answer to that question. We're trying to get information to you between the glitches. The governor's office obviously having a rough day today, but we will get the answer to that question because she was asking a very appropriate question. If the health department's making the call on closing a school because it's a hot spot, what are the metrics involved with closing that school? We'll have that answer for you later on this evening at 5, 6, and 10. And we apologize for the glitches, but again, coming, you would think just a few blocks down the road it would be a little bit better, but it was a rough day over at the governor's office. But still, there were some things communicated. The primary one being that Jose Romero has now taken over as the head of the Arkansas Health Department. That's no real surprise. He'd been the acting director, Dr. Nate Smith leaving, and now Jose Romero has officially been given that title. Another thing is 912 new cases, which is not exactly the way the governor wanted to see this go after the mask mandate. Instead, even though many of them are from the Chico Correctional Facility, still there are enough community cases that you cannot do a victory dance over the mask mandate yet. It is still just kind of leveling off and not going down. The plan is to test 100% of Arkansas's inmates over the next month. The goal 100% by the end of the month, and they've enlisted the help of the National Guard. And Johnny Key got up and gave us a helpline for parents. If you want to call, there's now a helpline that's been in operation since Monday. They can give you a status, they can answer questions, and if you didn't write it down, I'll go and share it with you again. 1-833-353-6050. You got the feeling with Johnny Key there today, there would be a lot longer question and answer, but unfortunately the glitches are not going to let us hear all of it. But he's going to be back on Friday, and you get the feeling too that as we get closer to August the 24th, the scheduled opening of the schools, Johnny Key will almost be a regular almost every day with the governor. Thank you for watching. We're going to answer some of the questions that kind of got glitched out tonight at 5, 6, and 10. Thanks for watching THV 11.